You're listening to Cyber 94 Podcast. If you want to break into cybersecurity with real-life experience, go to cyber94.com.
So, Chloe, picture this. It's 4 a.m. The entire IT network for a country's national health service just goes dark.
Wow.
Every hospital, every clinic, every patient record just vanishes from the screen. Doctors are left with nothing but pen and paper.
It sounds like the opening scene of a disaster movie, Ben. But this was terrifyingly real.
Yeah.
We're talking about the May 2021 ransomware attack on Ireland's health service executive, the HSE. It's been called the most significant cyber attack on a state agency in Ireland's history,
Right.
and the largest known attack on a health system, period.
And the most chilling part, when those screens went black on May 14th, the attackers had already been inside the house for 2 full months.
2 months?
This was a slow, silent infiltration that began with, well, the most mundane of actions, a single employee opening a single email.
Exactly. Back on March 18th, 2021, someone clicked on a malicious Excel file. That one click was all it took for a notorious cybercrime gang called Wizard Spider, they're believed to be operating out of Russia, to gain a foothold.
Wow.
For 8 weeks, they just moved through the HSE's network like ghosts, mapping everything, escalating their privileges, and preparing to deploy their weapon.
And what's truly maddening is that a post-attack report found the HSE's own antivirus software had detected the suspicious activity a month and a half before the main attack.
You're kidding me.
But the system was only set to monitor mode, so it saw the intruders, but it was powerless to stop them.
Oh, that's just infuriating.
It was like having a security camera but no lock on the door.
So when the attack finally came, the impact was catastrophic and immediate. This wasn't just an IT issue.
Right.
It was a public health crisis. Hospitals across the country just ground to a halt. Diagnostic services, CT scans, MRIs, all down.
Unbelievable.
So patients would show up for critical appointments like chemotherapy, only to be told the systems were offline and they had to go home.
The stories from the front lines are just horrifying. One leading oncologist, Professor Seamus O'Reilly, said something that it stops you in your tracks.
What was it?
He said, and I'm quoting, "The cyber attack was worse than COVID. Worse than a global pandemic. Because, at least with COVID, they had their tools and systems. Here, they were working completely blind."
Oh, darkly. And the attackers, using the infamous Conti ransomware, they weren't just locking data.
Oh, no.
They were stealing it. They began leaking highly sensitive patient information to the dark web to pressure the government into paying their, $16.5 million ransom?
That's just evil.
The Financial Times found samples online, admission records, lab results, even the private details of a man receiving palliative care. It's a level of cruelty that's hard to even comprehend.
And the damage spread beyond hospitals, too.
Right.
TUSLA, Ireland's child and family agency, was also hit. They lost access to the central database for 20,000 open cases. I mean, children in foster care, active welfare investigations, all of that critical information suddenly just inaccessible.
But despite the immense pressure, the Irish government stood firm. The Taoiseach, Micheál Martin, made it very clear no ransom would be paid. It was a principled stand for sure, but it meant the road to recovery was going to be long and incredibly difficult.
But then the story takes this truly bizarre turn. About a week into the crisis, the Wizard Spider gang did something no one expected.
Okay.
They published the decryption key online for free. They essentially handed over the tool to unlock all the files they had encrypted.
It's still debated why they did that. Was it, a response to the intense public backlash against attacking a health service during a pandemic?
Maybe.
A miscalculation? Or maybe a way to cause even more chaos? Whatever the reason, it didn't undo the damage.
Right.
The data was still stolen, and the systems were still a complete mess.
And the recovery effort was just monumental. The final bill was estimated to be over $100 million.
Wow.
They had to call in the Irish Defense Forces Cyber Unit. These are ethical hackers and military fatigues to go from hospital to hospital, physically decrypting machines one by one.
One by one.
It took over 4 months just to get about 80% of the systems back online.
Seriously, this attack laid bare a terrifying vulnerability. The report by PricewaterhouseCoopers concluded the HSE's IT system was, and this is a quote, a fragmented legacy mess that was never designed to withstand an attack like this.
A ticking bomb.
And to make matters worse, Ireland's National Cybersecurity Center was critically underfunded and understaffed at the time. It was a disaster waiting to happen.
Years later, the repercussions are still being felt. Hundreds of legal cases have been filed against the HSE by patients whose care was delayed or whose private data was exposed. This is a stark, brutal lesson that in our digital world, a single click can have life or death consequences, crippling a nation's ability to care for its most vulnerable citizens.
So here's a question we'd like you to think about. The attackers eventually gave back the decryption key, but only after causing immense harm and stealing the data.
Yeah.
So does an act like that change how we should view them? Is there a line even for cyber criminals, or was it just a strategic move in a heartless game?